It is wise that we temporarily remove these concentration points by closing all the primary and secondary schools, pre-primary, as well as all the universities and tertiary institutions for 1 month.
For many Ugandans, President Yoweri Museveni's announcement of the first lockdown remains unforgettable.
This is what the government has decided.
Almost every official measure to prevent the spread of coronavirus began with a 32-day limitation.
I've decided to close the education institutions even before the occurrence of a single corona incident, because I have observed the situation in other countries.
Nearly 15 million learners were forced to stay home. Reports emerged of a spike in defilement, teenage pregnancy and early marriage cases registered across districts. Several students like Womaru Muumbya, a resident of Buunga sub-county in Bujiri district, never returned to school. He was in Senior 4 when the first lockdown was announced. Today, he's a boda rider in Kampala city.
COVID disrupted my education when schools were closed, and since then I have never gone back to school except for a brief period when they were partially reopened for candidates. I sat for my exams and scored aggregate 49.
After experiencing financial independence, the rider chose to drop out of school and focus on making money. With help from friends and relatives, he moved to Kampala and secured a motorcycle. He has since expanded into other businesses. However, he hopes that one day, when his business is stable, he will resume his education. Uganda registered its first case of COVID-19 on March 21, 2020, a 36-year-old city resident returning from Dubai in the United Arab Emirates. COVID-19 also left a heavy blow to the economy. Banks, media houses and other businesses downsized, leaving many without jobs. Those who lived hand to mouth found themselves struggling to put food on the table. Though the government attempted to distribute food relief in different parts of the country, several households were left out. Desperate for survival, some Ugandans traveled long distances on foot in search of food from friends.
We had to walk from Sonde to Nakao. It's about 16 kilometers roughly. So we had to walk. We woke up very early in the morning at about 5. By 10 we were in Sonde. And then she came and gave us the food. But now the problem was going back. You're loaded and the distance you're going is more than 16 kilometers.
Public transport came to a standstill as inter-district movements were banned and a dusk to dawn curfew was imposed. Streets, once booming with businesses, became deserted. To enforce the restrictions, security personnel set up roadblocks. In some cases, enforcement turned violent. People found outside their homes past curfew time were reportedly beaten. Gradually, the government eased restrictions. On May 4, 2020, President Museveni announced a partial reopening of some businesses in the construction and informal sectors 43 days after the initial shutdown. When the first COVID-19 case was confirmed on March 21, 2020, Uganda's health sector was unprepared for what lay ahead. Today, 5 years later, the country still records COVID-19 cases, but they are minimal.
The cases that we shall be detecting over time are cases that are manageable. We do get cases in all the facilities where we are testing for COVID.
Dr. Ruth Aceng, the health minister, says the pandemic had advantages as it forced the government to strengthen the health sector's infrastructure development.
That for the lower health facilities, we constructed over 438 health facilities. Every regional referral has 10 ICU beds. Mulago has over 60 beds, Chirudo has over 40 ICU beds, so we have adequate capacity.
However, gaps remain. The country still lacks 178 ambulances. According to the Ministry of Health, ambulances are now allocated per constituency and not health facility and coordinated through a central dispatch center, which are still under construction. Several Ugandans learned hard lessons from the pandemic-induced lockdowns, especially the importance of saving for a rainy day and diversifying income sources.
Anything can happen when you least expect it. Now, I always keep that in mind and try to diversify my income by doing more than one job. If you earn 20,000 shillings, you should spend around 6,000 shillings and save 14,000 shillings because you never know what might happen tomorrow.
Uganda registered thousands of COVID-19 cases and lost over 300 lives to the pandemic. NOBERT ATUKUNDA, NTV News.